Hey ladies, do you have to cross your legs when you laugh, sneeze, cough, or jump? If you're shaking your head yes, listen up because we're talking about pelvic floor dysfunction, urinary incontinence, and how to fix it. I'm Dr. Nguyen, and I'm an OB/GYN provider at Magnolia Obstetrics and Gynecology.
Hi, my name is Krista Casse. I'm one of the PTs here over at North Oaks who specializes in women's health and pelvic floor dysfunction. Let's have a real talk about pelvic floor dysfunction.
The pelvic floor is a group of ligaments, connective tissues, and muscles that help to support the bladder, vagina, uterus, and bowel. When strong and healthy, they contract and relax and help to support these structures. Pelvic floor dysfunction is a common condition where your pelvic floor muscles are weak and can cause some bothersome symptoms. These symptoms can include vaginal bulge, leaking urine or stool, frequent trips to the bathroom, painful urination, constipation and straining pain during bowel movements, pain in the lower back, ongoing pain in the pelvic region, genitals, or rectum, with or without a bowel movement. Pelvic floor dysfunction affects about 25 to 45% of women at least one point in their lives. We often see this in women with increasing age, with vaginal delivery or injury during delivery, obesity, and genetic factors. During your evaluation, we'll obtain your medical history, ask you about your symptoms, and perform a pelvic exam. One of the treatments would be physical therapy, and I'll refer you to Krista to talk about that.
Pelvic floor physical therapy involves an array of different things, including incontinence, pelvic pain, and there's different ways we treat this through strengthening of the pelvic floor muscles, through stretching, biofeedback, modalities including electrical stimulation. Pelvic floor therapy can benefit you if you have trouble with urinary incontinence, fecal incontinence, pelvic pain, if you just can't hold it, if you have increased frequency of urination, if you're peeing on yourself, when you're exercising, and other things like Dr. Nguyen was talking about. We can help you learn how to do Kegels correctly, how to strengthen those pelvic floor muscles, as well as the proper techniques to gain control of your bladder and bowel again. It isn't just for women struggling with incontinence or pelvic prolapse, it also benefits women dealing with endometriosis. And for the guys out there, it's beneficial for men who suffer from prostate prolapse after prostate surgery.